Pixel Metabolism, Interface Ulcer Sustained Release Tablets. Please read this leaflet carefully before use or consult your pharmacist. Drug name. Generic name, Pixel Metabolism, Interface Ulcer Sustained Release Tablets. Ingredients. Each tablet contains 16,225,920,000 pixels. Excipients. Latex sheets, latex tubing, silicone liquid, resin, red velvet, cotton thread, artificial crystal, preserved female mantis specimens. Description. A virtual digital compound in a state of contradictory superposition. In physical form, it appears flesh pink and round. Once ingested, it converts into pixel fragments and secretes virtual antibodies. Embedded info can be viewed via electronic screens. Therapeutic category. Non-prescription psychological and dermatological aid. Blurs the digital-biological divide by ray-injecting virtual imagery into the body. Indications. Interface craving disorder. Compulsive desire to merge with virtual spaces. Patients poke screens repeatedly, believing in breaking the fourth wall, losing touch with bodily sensations during virtual interactions. Somatic disidentification syndrome. Belief in quantum links to Mars colonization. Symptoms include cognitive dissonance between hypermnestic satellite schedules and inability to visually observe satellites. Compulsive stargazing and 5 or more hours per day of space-related media. May include hysteria triggered by economic deprivation of space access, inability to afford suborbital travel, rejection of gravity, and aversion to bodily existence. Contact anxiety in human-machine interaction. Adrenaline-dopamine imbalance from AI replacement anxiety. 2 subtypes. Anti-AI paranoia, fear of human extinction coded into AI. Driving regression to primitive technologies. Digital messiah delusion, belief in illegally implanted brain-computer interfaces during sleep. Results in worship of silicon life and cyborg prophecy, oscillating between tech fear and arousal. Oral administration leads to rapid symptom relief. Also indicated for pruritic dermatoses, time-space perception disorders, amnesia, misogyny, and other dermatological and psychiatric conditions. Strength. 1 tablet equals 5 minutes and 13 seconds. Dosage and administration. Oral only. Adults and kids 12 and up, take 1 tablet a day. Adverse reactions. Possible effects. Visual fatigue, dizziness, tachycardia, palpitations, nausea, vomiting, especially from body horror imagery. Contraindications. Do not use if allergic to feminism. Contraindicated in those with racist beliefs. Warnings and precautions. Contains fibers, latex, and materials embedded with histories of colonialism, feminism, and indigenous knowledge. Users should acknowledge this historical load and avoid reinforcing gendered symbols. Aim for a critical, future-oriented framework. Possible side effects include reflection on sexual commodification and capitalist mechanisms. Survival of elders in smart tech society. Tech benefit disparities across class lines. Virtual antibodies don't replace real bodily experience. Maintain at least 30 minutes daily of physical contact activity. Discontinue use if the following occur: aestheticizing biological pain. Immortality salvation delusions. Class stratified identification with life extension technological privileges. This product does not resolve the clash between digital colonialism and bodily sovereignty. Cybernetic inheritance of trauma. Algorithmic structural bias. Temporal class gaps in tech access. Drug interactions. Enhanced effects when co-administered with the visible and the invisible, a cyborg manifesto, perception, reason, and self-knowledge, the age of surveillance capitalism, art monsters, fray, art and textile politics. Pharmacology. Through advanced bio-digital interface tech, virtual imagery is converted into bioelectrical signals via neural reverse encoding. By embedding textile histories in a screen-ruled, satellite-tracked, AI-driven future, the product fosters somatic virtual integration to recover touch, intimacy, and embodied awareness.